Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. My next question relates to the ages of the age rather of the person that's in someone's care. This is the Parents and Caregiver series, and that the age of the person I understand is sometimes critical with regard to access to information. At that access is quite a bit easier, I understand, if the person in your care is under 18 years old. How can adult caregivers, Cherie, make sure they have full access to adults in their care and access to the information regarding their diagnosis and treatment?
Right. You want to make sure that you have advanced care directives, which is a form that you can Google online. Every healthcare institution has them. Anywhere that you'd encounter a healthcare professional, you can get that document. And it basically is a way to outline who is supposed to have the information, who can have access to it, and the patient can give permission to other persons to have access to their information. If it's a situation where the your loved one, if they're unable to sign over that permission to you, or there's a barrier and you are their primary caregiver, you can go down to your county office and look into conservatorship or guardianship. And that can just be over their health. It doesn't have to be over their finances. There's different types. When I say conservatorship, Michael, a lot of people have heard that word in the news often related to Britney Spears, as she has struggled publicly with her bipolar disorder and being under conservatorship with her family, meaning they have control over her health decisions and her financial decisions. So there's kind of been a stigma around it, but it's really put in place to specifically provide the ability of the person that's providing care for someone to have access to information and also access to decide when that person's unable to decide for themselves.
I really appreciate that's a great example. You're right, Cherie. We all saw that play out in the media, and I'm a lifetime media person, so I feel like I can say the media sometimes will sensationalize things. You know, it's designed to get people to watch. You want clicks. You want your radio audio ratings to be high. So sometimes those details are sensationalized. So I really appreciate you kind of putting a for lack of a better word, putting a sane look at, giving us a sane lens that we can use to look at conservatorships. Really appreciate that. Whether or not you gain access to information on the person in the system, identifying an advocate within that system, someone with whom you can establish a rapport, someone who will advocate for you and your loved one during that course of care, that might be something you want to consider. Can you expound upon why finding an advocate within the system is so very important?
Absolutely, especially when it comes to involuntary holds, there are persons involved. So there are case managers and social workers involved. You also have public entities like patients' rights that you can call and find a patient advocate, as well as the Office of the Ombudsman, which is another advocacy, a government agency that's available to provide advocacy. If you think that something's being done to your loved one or not enough is being done, you can reach out to patients' rights in the ombuds office to get someone that's impartial, that doesn't work there, that can actually help advocate on your behalf. And then you can also use the resources within the facility, social worker, case manager, charge nurses, the psychiatrist or psychologist that may be involved. Ask for those persons to work with and get all the information and contact. Get that reliable contact. If you could find the one point of contact to ask all questions to and they advocate on your behalf, that's best so that you're not confused. And then take notes, write down who's involved in care, who to reach out for which concerns. so that you can keep up. Oftentimes in facilities, there's shift work, so it may be different nurses and other healthcare providers that may provide care for your loved one throughout each day or even parts of each day. So understanding how the system works, where they are, and who your point of contact could be is really vital.
Cherie, if ever there's an honorary brother in Brother Be Well, it would be you. You got all of this information and experience, and I love the way you give us, really concrete examples. Taking notes. That's something I wouldn't have thought about because sometimes the information is just coming so fast and furious, I would think, and you need to just, either on your phone or have a piece of paper and a pen and just take some notes so that when you get home, you'll remember so much of what you've been told.
Absolutely, even down to each day. Like a lot of people will call their loved one that when they're in a facility, writing down who the nurse is for the day. So if you have to call back, you can call and ask for that person by name to decrease confusion, things like that. So really just keeping track so that it helps you because it's hard to remember when your brain is under stress. It's hard for you to remember as well. So make sure that you keep track the best way you can.
That's a great point. I was going to say that you're already worried, you're a little distracted because your loved one, again, we've walked through it. They're going through something you haven't seen before. You might be a little unsettled or scared, for lack of a better word. So it's best to take some notes and keep everything clear. So helpful, Cherie. Really appreciate that. Let's talk about a little bit before I have to let you go. Psychiatric medications. They may be prescribed for your loved one, and I think it's important that we know a few things about them. I would think, for example, families may want to keep a log. We were just talking about taking notes. So keep a log of those meds, a record of each medication, the individual dosage, any potential side effects that might be there, or side effects that your loved one might have already been feeling by something that they're already taking. What else do we need to know about psych meds, and how much research should parents and caregivers do on them before their loved one starts on a treatment regimen that includes those meds?
Right. So, absolutely what you mentioned, having a medication list, what you're taking, how often, so that someone could very quickly understand what may already be in your system. Also, understanding that those types of medications should be in a secure location, locked away from kids, pets, or other family members that may come by, because they can cause harm to others, or some people abuse some psychiatric medication. So, you want to make sure that they're in a secure location. You also want to make sure that you understand the side effects, or if there's a major side effect that you're aware of it. For instance, the medication lithium has a toxicity level, which will cause some symptoms that may seem to be like a mental health crisis or even medical symptoms that may occur. So you would want someone to look out for that. Like you may not know that it's happening until it's severe, and then now you're getting emergency care. So you want to understand if there's a true large risk of a medication, or some medications cause a tremor, and a mild tremor may be okay, but if that is increasing or worsening, then that's a sign to reach out to the doctor and get a change. So really understanding what the medications do and when to seek help if something happens is key in managing medications for someone that's getting mental health medications.
Really appreciate hearing that too, Cherie. So, and I know so many of our listeners, a lot to think about, and we understand that. We try to keep these conversations very concise. There's a lot to think about, but certainly don't forget about medications, both going in, the log, and then paying attention to things and side effects and how your loved one is reacting is so very critical, so very important. Cherie, again, you're a former psychiatric nurse. I've said it before. You may be thinking of something that I've missed and we've missed in putting this conversation together. What other tips do you have for anyone who finds themselves navigating the mental health system, any mental health system?
You know, my biggest tip, in addition to patience, is to not give up, especially if you are the caregiver or a family member or friend. There's nothing more important than your support, in whatever form that may look like. So please don't give up on your loved ones. They need your support. They will need your support when they get through it and they're out of the system, so to speak. So that's not only a gift to them, but also yourself to be able to be there for them when they need it most. So have some patience, and as I mentioned before, have some prayer too if you're a spiritual person. It means the world to have your loved one there and not just a room full of strangers, even though those of us that may be strangers are really doing our best to provide care for you. It just means something different when it's someone that's in your life.
Yeah, it's got to be so very difficult. And you mentioned prayer. It's a great time to be a prayerful person, I would think. But that reminds me of the self-care component. We didn't talk about it, but let's make sure that the caregiver is continuing with those self-care things that we've talked about at Brother Be Well. You got to take care of yourself before you can take care of somebody else. So don't forget to take care of yourself and do all of the things that you've outlined. Cherie Kreiner, I always get a little down when it's time to say goodbye. I hate that word, so I'm not going to use it. Until next time, Cherie Kreiner, registered nurse and vice president of the Capital City Black Nurses Association. Thank you for being with us today.
Thank you so much for having me. I'll see you next time.
We'll see you next time. And I want to thank somebody else for this conversation. Our sponsor, Blue Shield of California's Blue Sky Initiative. That initiative boosts access to mental health support. You can learn all about it. It's a fantastic program at bluesky.blueshieldca.com. That's bluesky.blueshieldca.com. Another quick website that you need to know about, this one, brotherbewell.com. If you've enjoyed this video or this podcast, and you're interested in any one of a number of other topics related to the behavioral health of boys and men of color, go to that website, videos, podcasts, print pieces, links to resources, all kinds of information available to help you or the brother in your life. And that's anybody 13 and up, African American, Asian and Pacific Islander, Latinx, or Native and Indigenous, and the LGBTQIA plus people who enhance those cultural communities. It's all right there at brotherbewell.com. Check it out. We're a membership supported service, but there's great news. Those memberships are complimentary right now. So you can sign up as a member completely for free. When you do that at brotherbewell.com, make sure you sign up for the blog as well. Give us your email address, because then 2 or 3 times a week, you'll get notifications on your phone or tablet or whatever you use. And we'll let you know when videos just like this one go live. All of that is at brotherbewell.com. Check it out. My name, Michael P. Coleman. I'm content director for Brother Be Well. It's a great honor for me to serve in that role for you. I want you to do 2 quick things for me. If you would, take great care of yourself. Please, please, please do that. And then when you get that down, reach out, grab somebody, take great care of somebody else too. Until next time, bye-bye.